We're here today because 30,000 doctors overwhelmingly voted to reject the government's offer. And that's because they didn't go far enough on both jobs and pay. And on jobs, we are under-doctored as a nation. We have 40,000 doctors less than the EU average. And that's crazy because patients are waiting longer than ever for treatment and doctors can't get jobs. So we want to increase the total number of staff within the NHS so we can drive down the waiting list so that patients don't have to wait over 12 hours in A&E, in corridors. That's undignified, and that patients can have reduced waiting times for appointments. We're also here because pay has been cut over the last 15 years, and unfortunately the government is pushing further real-term pay cuts next year, and that's not acceptable. Well, I think the government needs to calm the rhetoric down and understand that to negotiate, you need to treat the other side with respect and dignity. And what we want to do as doctors is to ensure patients do get the care that they deserve, because they're currently, when there aren't any strikes, are not getting that care. We know that millions of appointments are being cancelled when there aren't any strikes each year because we are understaffed.
You good? Saw you on the news, you're good.
And that is why the government must move forward, must move quicker, further and faster on increasing the total number of jobs within the NHS. In pounds, 3 years ago, we were paid £14 an hour. With the pay uplifts and also the inflation that we had, our pay is currently around £18.50 an hour. What we're asking for is simply for a doctor to be paid £22.50 an hour. That is what a doctor in 2008 would have been paid had their pay gone up with inflation. That is it.
We're here today because we're sick of the moral injury that the government has placed upon us, really, by underfunding the NHS, undervaluing their staff members, and not paying them enough to stay or to reimburse the ill health that comes to them as a result of working in such a broken system.
As probably you've heard, like we've been calling moaning
minis
and juvenile delinquents. I've been doctor for 13 years. I've never moaned about my job. I love my job. I'm standing here. I don't want to be striking. I want to be working. I want to care for my parents, for my patients. So I've never moaned. I'm just asking, and we are all asking, is for pay restoration and just giving us the money that we actually are worth.
All of our other healthcare colleagues are working so hard to support us in hospital right now so that our patients can be adequately cared for whilst we are striking. And most trusts have prepared for safe staffing levels, as safe as can be with the lack of staffing that is present throughout the NHS. So, you know, every care has gone into trying to make sure that patient care is the best that it can be whilst we campaign for better patient care.